Okay.
So everybody, you know if I'm back, that means we have a new nonprofit. My name is
Yes.
Michael Randolph, and I'm with the Center for Nonprofit and Community Development. I want to introduce
Okay.
you to the latest person to start that nonprofit.
Yes.
Who are you and why are you starting your nonprofit? Share with the world.
Okay. My name is TOSIN Julius, and I'm with Midtown Outreach Inc. in Tampa, Florida. And our nonprofit is to help our community with the less privileged in partner with our pharmacy to be able to give out drugs to AIDS patients and help them.
So excellent, because I think the world might not know this, but when it comes to African Americans, the rate
Yes.
of HIV and AIDS is the highest, especially in the state of Florida. So when it comes to that medicine, that means lives are being changed and the quality of life is being extended. So share
That's
with
correct.
us, what you probably could be doing 1,000 things. What was it that impacted you and your life to want to start this nonprofit?
Okay, we do have a medical clinic, and we have seen like a huge volume of people coming without insurance, and they don't have money to pay for their drugs. And we thought it would be a good idea to have a nonprofit organization that we could help our community, because a lot of people are suffering and they don't have access to these drugs. So if we're able to get, for example, the 340B program, we'll be able to get the much needed drugs that all those patients need, and they wouldn't be in pain anymore.
Tell the world about what the program is you're talking about, because they have no idea. Let them know
Oh,
what this program is, and more importantly, how critical it is to reaching your goal and your objective.
okay. The 340 program is a program that is like the government has partnered with some of the manufacturers of these drugs, that they must give out this drug on a rebate basis, because only to the less privileged communities. So if we have that 340B that we can access through the nonprofit, we will be on that program and we can get the drugs directly from the manufacturers to the patients directly. And this is sponsored by the government in partnership with the drug manufacturers. And if we are able to have this, we can help our community through it, because they don't have to pay for the drugs.
So if I'm someone in social media, and I'm going to post this on all of my social media, that means it's going to go across the nation, and I
Yes.
wanted to donate. How
Yes.
can I donate? Do you have an email, a website, or how could I not only donate, but how can I find out more information about your program?
At the moment, we haven't put up a website yet, but we have the plan to put that together. So from our website, they will put the link on how they can donate to help. And also, at the moment, we have an account with Zelle, if that will be an option, with a phone number of the Midtown Outreach Inc. If anyone wants to donate through Zelle, that is also available.
Well, do you have an email they can contact you?
Yes, we do.
Okay,
And the
give us
email
that
at
email.
yes, the email is admin@midtowncommunityhealthflorida.com.
Besides money, what else can people give to help?
Besides money, if people want to volunteer, especially in the times when we have events, if they would like to come, we're in Tampa, we're in Midtown Tampa. If they want to come to our events and volunteer, to be able to give out food and help with the drug distribution to the patient, that would be really, really, really great as well.
Excellent. So I'm really appreciative that you came on and shared what you do as a result of your passion to make a change in the community.
Yes, sir.
So I'm so happy that nonprofit is up and running. The other thing is that as we begin to move forward, talking about other training that we provide, for example, CEO training, grant writing training, strategic planning, all that. Because we believe that as you begin to grow nonprofits, they grow in their capacity to service their clientele. So where you currently focus on? What target area?
I'm sorry, can you repeat that?
What target area are you focused on?
Our target is the less privileged HIV patients in our
But is it,
community.
I mean, location-wise, is it Tampa? Is
Oh,
it Florida?
Tampa. Actually, we can expect. We are open to expand outside of Tampa.
Excellent.
Once we've established the Tampa area, we can expand throughout the state of Florida. By God's
Excellent.
grace.
So your big picture is to expand. And in other words, you're saying that's the beginning.
That's perfect. Yes, sir.
So please share with the organization the name of your organization again.
The name of our organization is Midtown Outreach, Inc.
Let me ask you a question. Where did the name Midtown come from?
Because we're located in Midtown, Tampa, Florida, and we have a lot of, like people that needs to be helped in Midtown area.
Good.
That's why that came up.
I want to thank you for everything that you do and changing the narrative when it comes to especially health related to HIV and AIDS. I've done research over the years. I know how serious it is in the African American community. We talk about in some cases 3, 4, 5 times the rate when you compare to other ethnic groups. So it is a serious problem, and I commend you for everything you do. And thanks again for giving us an opportunity to present you to the nation. Thanks again.
Thank you so much, Mr. Randolph, for the opportunity, and I'm looking forward to getting to know everybody more and to be able to help our community to further our course.
Hold on one second. You did a good job. I think it came from your heart.